Hi, I am Professor Abuhana Mustafa Kamal and welcome to my channel. Today we'll discuss on few important topic related with acid-base disorders. The topics are anion gap, osmolar gap and base excess. So let's start. Before starting anion gap, let's come to know about the common serum ions. In the serum, most common cations are sodium and potassium, and most common anions are chloride and bicarbonate. Other than these four ions, there are few more ions in our serum. Some of them we can measure, some of them we cannot measure. Actually, anion gap reflects the total unmeasured anion present in our serum. So what is anion gap? The anion gap is the difference between readily measured cation and anions. Actually, it reflects the concentration of total unmeasured anions. Anion gap equal to sodium plus potassium minus bicarbonate minus chloride. The normal value of anion gap in a healthy adult person is 12 plus minus 4 millimole per liter. That means 8 to 16 millimole per liter. Why does normal anion gap exist? Previously I mentioned there are few anions present in our serum that we cannot measure. Actually, because of their presence, this normal anion gap exists. The most common unmeasured anion is negatively charged albumin. We can measure the total albumin level of our serum, but we cannot separate the which albumins are negatively charged. Other anions are phosphate, sulfate, lactate, and some organic anion like keto acid in blood. What the importance of knowing this anion gap? By knowing this anion gap, number one, we can categorize the metabolic acidosis. All of we know that metabolic acidosis mainly two types. One is high anion gap metabolic acidosis. Number two is normal anion gap metabolic acidosis. And their correction method is different. So, categorization of metabolic acidosis is very much important. Number two, by knowing the anion gap, we can differentiate pure high anion gap metabolic acidosis from the mixed anion gap disorder. And last but most important is in some case we will get the blood pH level is normal but the acid base disorder is present in the patient's body. By finding out the anion gap, we can detect this type of acid base disorder. Now, some pathological causes where anion gap is very high. For keep remember these causes, a small trick you can apply, that is the Kushmal breathing. It's a specific breathing pattern. The spelling of Kushmal is Kussmaul. By using the letter of the Kushmal, we can keep remember the causes of high anion gap. Look at this. K for diabetes ketoacidosis, U for uremia of renal failure, S for sepsis, S for salicylate poisoning, M for methanol toxicity, A for aldehyde, that means ethylene glycol toxicity, and L for lactic acidosis. By this way, it will be easier for you to keep remember the causes of high anion gap. So now let's talk about the osmolar gap. What is osmolality of plasma? the presence of total osmotically active particle in plasma, we call it the osmolality. How this osmolality can be calculated? It can be calculated by this way: osmolality of plasma equal to 2 into sodium plus 2 into potassium plus blood glucose level plus blood urea level, and all this will be calculated in millimole per liter. So this is the calculated value of plasma osmolality for a healthy individual. Now, in a patient, if you measure the patient's blood sodium, potassium, blood glucose level and blood urea level, then you also can calculate the patient's plasma osmolality. If there is a gap between the calculated value of a healthy individual plasma osmolality with the patient's plasma osmolality, then we say there is osmolar gap present. Okay? So, the osmolar gap is a measure used in medicine to assess the presence of unmeasured osmotically active particle in blood. It is calculated by subtracting the calculated osmolality from the measured osmolality of the blood. So, osmolar gap equal to measured osmolality, that means patient's plasma osmolality minus calculated osmolality, that means it is previously given plasma osmolality of a healthy individual, and normal osmolar gap is less than 10 milliosmol per kg. So, why should we know the osmolar gap? Actually, there are different types of alcohol poison, different type of alcohol, like ethanol, methanol, ethylene glycol, diethylene glycol, etc., etc. This alcohol poisoning easily we can detect by finding out the osmolar gap. Okay? Now our last topic, base excess. What is base excess? It is the difference between the present or actual bicarbonate concentration of a patient and the standard bicarbonate concentration of a healthy individual. So bicarbonate equal to bicarbonate base excess equal to actual bicarbonate of a patient minus the standard bicarbonate. Positive base excess always indicates high plasma bicarbonate concentration, and negative base excess always indicate low plasma bicarbonate concentration. So, in which condition the base excess, which type it will be exist? Let's check. Normal value of base excess is plus minus 2 millimole per liter, and positive base excess we will find in metabolic alkalosis. Of course, in metabolic alkalosis bicarbonate level as high, so positive base excess we will get, as well as in respiratory acidosis. Why in respiratory acidosis? Because of the compensating mechanism. In respiratory acidosis, partial pressure of carbon dioxide level is high. To compensate it, bicarbonate level needs to be high, and positive base excess we get. On the other hand, negative base excess we will find in metabolic acidosis. It is due to compensation mechanism and respiratory alkalosis. So that's all for today. Hope you have enjoyed the video. If you like it, please subscribe my channel. You will get more and more such video, inshallah. Thank you very much. Assalamu alaikum.